I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore Iowa's stories of survival, hope, and inspiration. Today we're going to talk about the innocent victims, your children, the lost children of the pandemic. If you think there's a lot of confusion and even chaos in the media, you're correct. And often the innocent victims of that confusion are the children. A leading expert on infectious diseases, Dr. Megan Srinivas, will talk about the risks children face and make sense of the pandemic in a way your children need to know. Megan, welcome to the show. You have such a fascinating background and so much wonderful research. Please share a little bit about why you're here and what you do with our
Well,
audience.
thank you so much for having me, Peter. This is such a wonderful topic and an important, timely topic. So as you mentioned, I'm an infectious disease physician. So I went through all the training and I'm board certified to treat infectious diseases and work a lot in this area. In the setting of COVID, it's become really the epicenter of our world and a lot of what I'm doing my research in. I also sit on the Public Health Advisory Committee for the Infectious Disease Society of America, who comes up with a lot of the guidelines and recommendations surrounding COVID policy right now. And then I also sit on the Council of Medical Services for the American Medical Association, where I'm also a national delegate. So we're doing a lot with the public health initiatives on educating the public. And then in my hat as a faculty member at the University of North Carolina, we're doing a lot of projects through them. And one of the projects I'm actually doing is looking at how to better communicate the important health messages around COVID to all different types of populations, including children, and addressing their mental health. Mental health has been something I've been involved with for a while. I actually sit on the Iowa National Alliance for Mental Illness Board. And so this goes hand in hand with what we're really facing in the pandemic today.
And for those of you seeing here for the first time, you grew up in Fort Dodge.
I did.
You're an Iowan, and you're very prominently educated. Your resume would take up the whole show. So it's great to have you on. And it's great that you focus so much attention on youth. I know I've read some of your bios about some of your experiences, even internationally, and you've always had a passion for youth and providing health services and mental health services that can deal with crises like this.
Mhm. Most definitely. I strongly believe that what we put into our children now, whether it's messaging, whether it's experiences, that's really going to frame how they handle the world, whether it's 6 months from now when they're back in school, or 6 years from now, or 60 years from now. And so it's so important that we give them the right foundation on which to launch themselves.
Now, I referred to these children as sort of the innocent victims, the lost children. For all the craziness we see on TV, there does not seem to be a consistent message to children. Is this a problem? I mean, are we vacating an important responsibility by not engaging them in more direct dialogue?
Most definitely. So the issue is a lot of people are facing stressors right now. Parents, caregivers, whether it comes to their job, whether it comes to their finances, whatever is happening in their immediate world, aside from even the health consequences of COVID, they're thinking about the ramifications that's happening to enable them to put food on the table, to enable them just to function. And because of that, the children are often, unfortunately, being overlooked, not intentionally. It's just when people get so stressed about wanting to provide for those who are dependent on them, they forget about the emotional needs and they don't realize that children are sponges. Anytime that you are stressed or anxious yourself, your children know. It's not that they might conscientiously realize it, but your actions, your behaviors, they're all nonverbal signals to our children that they soak up, and that causes themselves anxiety. We see it in the form of temper tantrums becoming more common. We see it in the form of bedwetting, increased nightmares. It's not exactly a manifestation where the child's going to come out and say, "Hey, mom, dad, I'm worried," because you're worried. You're going to see it in altered behaviors, altered eating patterns, even slight differences in their behaviors that wouldn't normally stick out. And it's those small changes that add up over time that should signal to you that your child is also feeling anxious. They're also feeling stressed, and it's so important to tend to those needs.
Well, we're seeing, and I've talked to a few parents before the show and asked them what their concerns were, and many of them think that they're protecting their children from undue stress by not having direct dialogue. And that's not probably not uncommon. I mean, growing up when I was a child, I didn't know when my parents had economic problems. I didn't know much about global problems. I knew about the school kids and stuff, but the world's changed now. Now, when the parents disconnect, the children have ways to connect with the world.
Mhm.
And if I can be any measure of what we're seeing, there is not a real cohesive message about how to deal with the stress of the pandemic for anybody, adults or children. And children aren't stupid. They are thinkers.
Mhm. Most definitely. It comes from not only picking up the subtle behaviors, children are so good at that. If there's a slight behavioral change at home, they understand that, even if they don't know how to verbalize it. But it's also just having the news on repeat and hearing about all of the stress that's happening because of the pandemic. Children soak that up. So, one of the most important things is actually to sit down with your children, reassure them that they're okay, that you're going to be okay. UNICEF is actually launching a huge effort on trying to communicate with children because they're realizing that they really are the ones that are being ignored in this pandemic, not just from a health standpoint, but specifically from a mental health standpoint. Have somewhere where your children can turn to, whether it's an aunt or a friend that your child knows they can call whenever they're feeling overwhelmed. Have a point person there, or if it's yourself, spend a little time at night comforting them, maybe reading them their favorite story, but just ensure they understand that there's open communication. And so that way, if they do feel that stress, if they do feel that angst, they know they can come to you or somebody that cares about them and express that so it doesn't come out in unhealthy ways.
Let's take a short break, and I'd like to revisit that. When we come back, let's continue the conversation that children and parents need to hear about the pandemic so we can sort of give them some information and talking points that would help them get over this hump. We'll see you after the break. You don't want to miss this.
While a lot is changing in our world, at Mediacom, our focus remains the same, making sure you have the fastest, most reliable connection possible. During this critical time, we know your needs are changing. You may be working or learning from home, relying on telemedicine, or finding new ways to keep everyone entertained. If you need more speed, call or go online, and Mediacom will double your speed immediately for as low as $10 more a month for 1 year.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Welcome back to Surviving Bad. We're talking about the things every teenager, their friends, brothers, and sisters need to know about COVID-19 and the pandemic. It's about time they're included in the conversation. Megan, you had some talking points you wanted to share with us for parents and kids. What's important for them to know?
The first thing that we have to realize as adults is that children are very intelligent. They understand if we sit down and actually teach them things, they are willing to listen and learn. And they really soak it up, not just from what you say, but also your actions. So you modeling the right behavior is going to enable them to understand the right behavior. When I look at children that we see in the hospital, unfortunately, there are 2-year-olds who have underlying issues such as cancer that require them to have to wear masks. Even though they're only 2, when we tell them you need to wear this mask and we explain it to them, we might need to give them reminders. We might need to hand it to them every now and then, but they're still willing to do it. It's not a punishment if you explain things to children and tell them why we want them to do it. And honestly, we sometimes model it ourselves. If I'm in the pediatric wing working with little kids, I'll wear a mask if they need to wear one, just to show them that I'm in it with them. And it makes it something that they can understand and start doing. There are also ways that you can make it fun. You can turn a mask into a superhero costume. You can turn a face shield into an Iron Man helmet. These are all ways that you get kids involved and you get them motivated to take part. The most important thing, especially as we're talking about returning kids to school, is ensuring that they're safe and that they keep others safe to reduce that transmission risk within their schools and ultimately within the communities. And the best way to do that is through face coverings, whether that's a face shield, whether it's a mask, either, both, whichever way you feel most comfortable, as long as they're wearing one or the other. It is going to be one of the most effective ways to reduce that transmission, to protect your child, and to protect your teacher and the other kids as well. On top of that, hand washing. Hand washing is that lesson that we learned when we were all in kindergarten, that we were always told you can sing the happy birthday song, and as you're singing, wash your hands, and that'll be long enough to actually get rid of the germs. The same thing works with COVID. So let's keep on doing that hand washing, drill that in even more to our children, and remind them that it's so important. You can give them a bottle of hand sanitizer if they're old enough to understand how to use it, and have them carry that with them to school as well.
Now, we've had some parents, didn't mean to interrupt you, but we've had some parents say, it's hard because we don't want to admit to our children we're scared or that this is scary. And so sometimes we live and act as if there's nothing wrong, set up these boundaries, but we don't tell them what the boundaries are. We go, how come we're not going to visit our friends? Well, we'll get to see them another time. They sort of deflect the issues instead of talking about them. Mm-hmm. And that's a hard thing for parents because you're supposed to be the protector. You're supposed to be their hero. How do parents approach this? I mean, you have to do it with them in a medical setting all the time, but in a family setting, it might be that many parents are irresponsible about masks because they almost don't want to start a sort of a feeling of fear in their families.
So in all honesty, the biggest thing that causes fear in children is the unknown. It's the same for adults too. And so actually confronting the issue and explaining things reduces that fear and anxiety in your child. And you don't have to talk about the deaths. You don't have to talk about the horrible ramifications of COVID. We can sit down and simplify it with our kids. I could say, Peter, there is a virus out there. It's kind of like the cold virus. I wouldn't tell that to adults, but I would say that to a child because that's kind of something that they would understand. And we want to make sure that we just don't spread this virus because it can make some people, especially older people, really sick. And the way we can do that and protect our family is wearing this mask. But then you can also turn it into a game, depending on their age. You can say, this is a magical mask that will help to keep you safe. If it's an older child, you can give them more information, more of that scientific basis as to why it's so important to wear the mask. Keeping these secrets from our children is what makes them more anxious. It's what drives fear at the same time as preventing us from protecting them.
Does that work as strongly with teenagers as well, that have a little bit more of a mindset on some of these things?
So as we get to teenagers, really, they are at that stage where understanding the details helps them grasp what's going on. So that's a point where I'd say, don't keep information from them. Sit down and tell them, yes, this is a dangerous virus. And it's really important for teenagers to understand that they're not immune, because that is a myth that's been going around, a misconception people have been believing. So sitting down with your teenagers and having a very honest conversation will help them understand. You're not drilling fear into them. None of us should be afraid of taking the right steps to protect ourselves. It's like when you get into a car. We all put on a seatbelt, not because we're afraid of an accident, but because we want to prevent additional injuries if it should happen. And that's the same way we should approach wearing a mask. It's to prevent a bad thing from happening, not because we're scared of that bad thing.
These are great points, and we'll continue on them after the break. When we come back, we'll talk more about why children, teens, and young adults are often kept out of the loop, not only how it feels, but why it's a bad idea to keep the truth from them. See you after the break. You don't want to miss this.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Right now, millions of people and billions of devices are connected to the internet. Homes, businesses, hospitals, schools. The security and reliability of these connections are more important than ever. That's why at Mediacom, we've built a network to protect them. A network that sees threats, fixes problems before they occur, and keeps you going with 99.99% network reliability.
Welcome back to Surviving Bad. I'm your host, Peter Komendowski, and we're talking about how tough we're making this crisis for our children and some of the misconceptions that are driving actions that probably would be different if parents knew the truth. With us, we have Megan, a doctor that's highly respected for her work in infectious diseases and that cares a lot about children. A question that was asked on the break, Megan, was about children and the transmission of the disease and the symptoms. What can you tell us about what we know currently at the risks that children face and how they fit into this whole scheme with school coming back in session soon?
So early on in the disease, we noted that older adults were, of course, at very high risk of having severe complications and even death. And when we broke it down by age group, we saw that every single age group had a higher risk of mortality than they normally would. That more compared to the flu or other viruses, significantly higher. But it definitely had predisposing factors, such as if you're obese, if you have lung issues, whether that's COPD or asthma, if you have diabetes, if you have any kind of heart condition, even just high blood pressure that's well controlled. Even if these things are all well controlled, you still have a higher risk of a serious complication. And we do see some of these things in our kids. We see diabetes at a younger and younger age in these generations. We're also seeing things like overweight and obesity, asthma. These are all common things, unfortunately, we do see in the child population. So we have to take those predisposing factors into account for those kids as well. But on top of it, when we were looking at the age breakdown initially, we saw that kids were not having as many deaths as adults. However, that led to a misconception that kids weren't getting the disease, that kids couldn't transmit the disease. The issue is we were limiting kids' exposure because we had statewide shutdowns of schools. We had kids staying at home, kids being protected because we were reducing their interactions with one another. Playgrounds were shut down throughout Iowa. And it was done with good intentions, and it was very good that it was done. But without that data, we were making a lot of assumptions about children that we shouldn't be making. And now that we're looking at the recent studies that are emerging, one actually just came out last week from the Journal of American Medical Association, or JAMA. And they published a study that was done where they looked at the impact that school closures had, the statewide school closures had on the spread of COVID. And they found that it actually reduced the spread of COVID about 62% in total cases, and the deaths secondary to COVID by 58%. And that's not saying that those kids would have been the cause of or would have been the ones that were sick, or would have been the ones dying. It's saying that it reduced the kids becoming both sick, but also carriers that would transmit it to other people, like their caregivers, their family members. And that impact is astronomical because they did it early on before the pandemic got out of control. So putting kids into a situation where we wait for a pandemic to get out of control, for them to all become carriers before we shut down schools, is very dangerous. We have to be able to gauge this early because we understand now that kids are active transmitters of this disease.
So I'm not trying to put you in a corner into politics, but we're sending the kids back to school under this assumption that they're not severely at risk because it's based on an assumption it's based on no data. We protected them very well because we took them out of school. What can parents expect here? I mean, does this put the pressure back on the mask issue and the face mask? Because if they're going to go back out there, they need to have protection?
Yes, definitely. The thing is, so they actually did a one study, the CDC did, where they looked at a sleepaway camp in Georgia. It was a 7-day sleepaway camp, had kids ages 6 through 19 enrolled. There were about 560 kids. And of those, half of them ended up becoming sick from COVID. And the median age was 12. So when we looked at the younger kids, they actually were the ones who became at higher rates sick with the infection and transmitting it to others than the older kids. And the older kids, we expect to have a physiology similar to adults. That coupled with a recent study that also came out earlier this month that showed that younger kids, those between 5 and 10, are actually having higher amounts of virus being carried in their nasal passages, which is where we test, make us concerned that they're going to be huge transmitters of this disease. So as schools reopen, it's a huge issue. And the data coming out of the World Health Organization that has looked at other countries around the world who've reopened have found certain ways in which we can help to mitigate the spread of disease with having schools open. One of the huge issues is your community prevalence. Even before starting school, they recommend that you're below at least 5%. And one of the best ways we can do that is having our communities wear masks. Even 3 weeks of wearing a mask in Iceland drastically reduced the community prevalence of the disease. And right now, we're about 3 weeks prior to school starting. We could do that as a state if we all decide to wear masks or face coverings, face shields, and really set up a better plan for success for our kids.
Do you have any idea why people are afraid to recommend masks at highest levels of government?
I'm not sure, in all honesty. And at the highest levels of government, we've seen it flip-flop. It's gone from masks to no masks. Initially, there was a PPE shortage. And initially, this was way back in March. There was a concern that a lot of people were going to start buying the masks that our healthcare workers needed and our essential workers needed to keep lives afloat. And I think a lot of that messaging came, unfortunately, from that point. But at that point, we also didn't understand the impact that a simple mask could have on stopping the spread of this disease. When we finally discovered that, it was into April. And when that messaging changed, a lot of people were already hooked onto the old messaging. And it's really hard to change people's minds, for people to understand that science changes so rapidly, especially in the setting of a new disease. But that's something that we really need to do a better job of expressing in the public health world. We put out new edicts, but there's really not enough explanation behind it. And unfortunately, when we don't have political leaders giving the right messaging, it's really hard for science to abut what your political leader is saying.
Well, that's a great point. And we're going to take a short break. And I'd like to invite you, Megan, to share some final comments and good advice with our audience when we come back. Stay tuned. You don't want to miss this.
I don't know how we would have survived without Mediacom. We have 5 kids, my wife and I, and we have Mediacom for all of our internet and all of our cable services. So I'm stuck in my house, but at the same time, I'm connected to people all over the world, and it's been fantastic.
Thanks to Mediacom, I've had reliable internet to continue to work business as usual, that I can continue to provide for myself and my family.
Right now, we all feel like the world is in a standstill. The internet has played a huge role in allowing us to stay connected to our jobs and the kids' schooling online and finding fun and creative ways to stay connected with the ones that we love. We couldn't do it without Mediacom.
Welcome back to Surviving Bad. We're taking a moment to talk about what's really important as we send our kids back to school. Megan, it's been 4 months or somewhere around that since this started. Is there any reason to think it's any less serious or less dangerous now than it was then?
No, unfortunately, it's actually far worse right now, especially in places like Iowa, than it has been this entire 4 months. And it has to do with the fact that we've essentially just given up and given in. If we don't put proper mitigation strategies into place, our trajectory is just going to continue to get worse. And those strategies are social distancing, wearing face shields or face masks, hand hygiene. It's all about prevention.
And parents need to talk about this with their kids. I mean, this needs to be a real important dialogue.
Definitely. Kids can't understand if we don't tell them. But if we tell them, they understand a lot more than we give them credit for. So being able to explain that they need to follow these mandates for the health of the community is not scary. It's expressing to them why we're behaving the way we are. So they have an understanding and they can do it too.
So if a child is going to a school, they're going to encounter kids that aren't wearing face masks, that aren't doing stuff. And I mean, parents need to address that. and talk about how important it is that they do this. We don't hear a cry for schools to police this kind of an action. Everybody seems to think that policing an action, we have stop signs in this world, we have speed limits, but all of a sudden when it comes to face masks, it's not appropriate to say they're necessary in a situation. What can you emphasize for children and parents to get this message across so that we have the safety they need to get through this?
Parents have a large voice, a very loud voice, that if they want to use it, they can and they should. And unfortunately, right now, as you alluded to before, it's really the policymakers that are making the decisions, and not scientists, not medical professionals. If you look at all the data, if you look at what all the medical professionals, even here in Iowa, are saying, even from the University of Iowa, several of my colleagues are openly saying, we need to get this under control. We need to have mask mandates. We need to do this for our community as a whole, but also for our children if we have any hope of returning to school safely. And listening to those voices and reflecting that you want to follow that advice, that you agree that you want your local school district to use masks, that you want your children to be safe, tell that to your school board. Tell that to your state legislatures. Tell that to the governor. Use your voice right now to advocate for your children.
So in your opinion then, do you believe that it's relatively safe, I say relatively safe, if children can practice social distancing, wear face masks, and practice hygiene, that we probably could bring the schools back safely?
Not right now, unfortunately. Right now, our community prevalence is far too high. This past week, we were already above the 10% threshold and heading to even higher rates of positivity. When we have a community penetrance that high, all the data from the World Health Organization, from the CDC, and even the Surgeon General says that we shouldn't be having kids in school. So to say that we should violate all of these authorities who've looked into it, all of the data that we have, would be really, it would be unconscionable for me to make that recommendation at this time.
Well, let's hope that under the circumstances that parents and children work together to practice as safe an entry into schools as possible so that we don't have a major disaster. And if we do, may God bless us in getting through this. Megan, thank you so much for sharing all this information. And I know it's going to be important for people to hear. Thank you for joining us today. You can go to our website at ahealthyiowa.org for more information. Keep your eye on Mediacom MC22 for our next episode of Surviving Bad, where we explore Iowa stories of survival, hope, and inspiration. And Mediacom MC22, your local programming leader.